Now I wanted to shift to talk about equity with regard to COVID. In the spring of 2019, Milwaukee County declared racism as a public health crisis, making equity a key focus of all that we do. And when COVID began several months later, we were committed to transparency in our work to address the historical and systemic inequities that were exacerbated by the pandemic. When we launched our Milwaukee County COVID-19 dashboard, we put race and ethnicity data front and center. And it was not because we were proud of our standing in this regard. In fact, in April of 2020, the Washington Post reported us as having the largest disparity between our population of African Americans and our COVID deaths among African Americans between the 9 jurisdictions that were actually reporting race and ethnicity data at that time. Only 9 in the entire country then. Now, to put a point on this, every single one of our 15 first COVID deaths in Milwaukee County were people of color. Since the pandemic began, we, and this is the collective we, the city, the county, the health departments, the fire departments, and the health systems, we have worked to address these disparities. We've shared detailed data on cases, hospitalizations, and deaths by race and ethnicity to shine a light on the disparities. We developed a SAFER model to target areas of high disease burden and low testing to better place testing centers in highly affected communities. We've worked with local partners to provide targeted messaging to vulnerable communities. We developed the EVE model to understand and facilitate equity in vaccination. And we've ensured vaccine availability and access in our vulnerable communities, whether it's through vaccination sites, by knocking on doors, or in some cases by administering the vaccine in living rooms. With these efforts and many more throughout the community, we have seen progress.